Let's take you back now to Boksburg, where the death toll in yesterday's gas tank explosion in Boksburg has increased to 15. Minister of Health Dr. Phaahla and Gauteng Mnisi for Health Nomantu Nkomo-Ralehoko visited the site and the OR Tambo Memorial Hospital this morning and briefed the media. Linda Mnisi is with the delegation and joins us from Boksburg. Linda, great to catch up with you. What's the latest coming from that media briefing?
Hugo, I think one of the important things coming out and one of the things that as journalists we came here to hear was the update on how the patients who are admitted in hospital are doing. As you can imagine, that blast left a devastation. Many families still asking themselves what could have happened, and the figures that we're getting today is that, the death toll has risen to 15. This morning when we got here, you'll remember the number was standing at 10, really still staggering, but it has since increased by another 5. Quite interesting that the health minister points out the kind of, treatment that goes into treating burn wounds, saying that things can change at any moment. So that gives us an indication as to why there has been a change in such a short space of time, leading to 5 more fatalities. Let's listen to what he had to say about them.
In terms of fatalities, as of yesterday, the report we had was that 10 people all in all had succumbed to this fire by yesterday. But the update which we are getting for today is that this number has risen to 15. 15 people now as of this morning.
All right, so that is the Health Minister, Dr. Phaahla, talking to us about the numbers and where they are standing at, telling us that, in fact, 3 of those 15 people are, in fact, staff members of this hospital, that he also had an opportunity to assist and do a walkabout. You'll remember yesterday it was revealed that a portion of the hospital had indeed been affected by the blast. We saw, through the walkabout, some of the ceilings that have fallen, and some of the structural issues that were suffered as a result of that deadly blast. So at this moment we understand experts are still conducting those investigations to determine the structural integrity of the hospital. So at the moment we're told that they haven't been receiving any admissions or haven't been doing any admissions. They've stopped, in fact, and are diverting patients to other hospitals. They've appealed also to members of the public to look at other facilities for medical help. You'll remember it's one of the busiest times of the year, the peak of the festive season, and usually trauma wards and emergency units are usually busy around this time. But this facility says at this point, given what happened yesterday, it cannot be taking in new patients. They've diverted those patients. But, in terms of the experts that are conducting investigations into the structural integrity, they're hoping that there won't be much that needs to be done, or that the hospital won't need to be evacuated. Let's take a listen.
At this stage, we are optimistic, even though we await the experts, the structural engineers who have already been on the scene, and they are going to be continuing to do their assessment. We are optimistic that the major structure of the buildings of the hospital hopefully will be found to be still sound, so that it can be salvaged.
Okay, so at the moment, Hugo, the health minister telling us that those who are injured have been, split into various groups, taken into different hospitals. So how they're doing at this point is not something that they would have readily available. So because of the nature, of course, of the burn wounds, and they're telling us that it depends on the degree of the burn wounds and what then would have happened in the last 24 hours and the decisions, the kind of decisions that those hospitals would have taken. They've run us through the hospitals that the patients have been taken to. It's Bethaqoa, Far East, in Springs. They're telling us about Baragwanath Hospital, Charlotte Maxeke, as well as Lenmed. As we understand, some of them have been taken to private hospitals. So at the moment, we have 15 family members who are not celebrating celebrating Christmas, Hugo, but are grieving their loved ones, still with many questions but no answers.
Linda, Mnisi, our prayers and thoughts are definitely with those family members. Appreciate your time this afternoon.